If you ever want to get your knee to bend fully again, this is what a typical rehab progression looks like at IDPT, to go from a limited and stiff knee to being able to fully bend again. What's up, guys? It's Dr. Joe Ruskowski here from Identity Physical Therapy in Livingston, New Jersey. What we're going to talk about today is the alarming statistics around athletes who actually can fully bend their knee again or get full knee flexion range of motion back after ACL surgery, and what a progression looks like from day one until the end here, with a methodical step-by-step and an explanation of why we do it to get you that full range of motion back. So we did some research, and what we found was the first alarming study was 423 ACL athletes. And at the end of this study, only 31% actually got their knee flexion back to over 130 degrees, meaning they were able to bend their knee again to at least 130 degrees. Now, what's so alarming, obviously that's an extremely low number, being 31%. But what's even more alarming is that here at IDPT, we consider full knee flexion range of motion actually at 140 degrees or higher. So that means that out of those 31%, potentially at least maybe half wouldn't have even passed our criteria for full knee flexion range of motion. Think about how limiting that is when you're trying to bend, you're trying to squat, cut, any of those things where you need to get low and then push out of it. Another study showed that only 50% of athletes ever regained a symmetrical strength compared to their non-operative leg. That's 50%. And so out of those 50%, they never got back to full sport or full competition because they couldn't even develop power through that leg. And so knowing these statistics, and I'm sure there's so many more out there, then what we need to do is place extreme emphasis on getting that knee flexion range of motion back. So what we're going to do today is go through a basic progression that we use at IDPT from easiest to most challenging, from earliest to latest in the stages of rehab, so that we can make sure that you get that full knee flexion back and you don't experience puffiness, achiness, and limitation with all your bending movements. So the first thing that we're going to do is actually reset the position of our pelvis and reset the position of our tibia, because our tibia has to come in as we fully bend our knee, and the hamstring that we're going to use to help do this also attaches up top to the pelvis. So we want to stabilize both. So the first thing that we're going to do is nice and easy. We're going to be lying on our back. You're going to roll your hips underneath you because that's going to shorten up the top of the hamstring. From here, you're going to gently press your heels down into the ground without lifting your toes. From here, you should feel tightness in the hamstring. At this point, we're going to reach our arms up to the ceiling. You're going to take a soft but full breath in through your nose, and then you're going to breathe out through your mouth for as long as possible. I want you to do about 10 breaths of these, and we're going to go 3 times, so it's going to take a bit of time. All right, now that we've down-regulated our nervous system and taken away that heightened sensation in your body, now it's time to start to try to mobilize that knee and start regaining range of motion back. So what we're going to do is something that is going to actually use gravity to help us bend that knee without causing any symptoms or any pain. Remember, getting range of motion back should always be pain-free. So what we're going to do is let this foot just slide down the wall. And once we feel any restriction or tightness in the knee, that's all that we need to do. So in the very beginning, we're going to have a lot of weakness, and it's going to be a little bit painful, and we want to avoid that. So we're actually going to use our other leg to slide us back up the wall. And then we're going to slide back down and back up the wall. And I like to do this for minutes at a time because we want to get some good motion in there and start getting this knee moving. As we start to progress that, we're going to be able to bend it more and more, and then we're going to use our own leg to bring it back up on the wall. So now I actually want to start to get that hamstring contracted a little bit more, because like I said earlier, the end of that hamstring attaches to the back of the shin bone, and that's going to help pull that knee bent. So I'm going to get into this position here with my knee above 90 degrees. So if this would be 90, I want to go higher than that. The whole foot should stay on the wall, and the other leg is going to reach up to the ceiling. From here, we're going to get our hips to roll underneath us again, and we're just going to push through the wall through our heel. We're going to hold this for about 30 seconds at a time, and I want to perform at least 3 of them. As we look to challenge this and progress this more, I like to bend that knee all the way to 90 degrees. Typically when I do this exercise, I don't like to bend it past 90 because what that's gonna do is put more weight through the front of your foot, which is gonna put more pressure through the front of your knee. Remember, we wanna feel hamstring here. And so I wanna make sure that my weight is on the heel more than the toes. So the best way to progress this is not by bending the knee more, it's actually by now lifting up in the air. Now back to my previous point, if I lift really high in the air, you can see how we're gonna lose that 90-degree mark from our shin to our thigh. So believe it or not, we actually don't wanna lift up that high. And if we do try to lift up higher, let's just put that foot up on the wall more so we can go higher and get that hamstring recruited. Same deal here, we're gonna hold this for at least a minute. The last progression of this is to come up into the air and then we're gonna drop down and come right back up. So when we do this, we're actually not squeezing our glutes because remember guys, we're not trying to strengthen or squeeze our glutes, we're trying to get our hamstring involved again. So what I recommend typically is to go about 20 at a clip and I like to see 4 or 5 sets. We should not feel any aching in the knee. All these exercises can really be done in the first week, 2 weeks, as long as your surgeon gives you clearance that you don't have any restrictions as far as sticking to 90 degrees. If your surgeon gives you restrictions that you have to stay at 90 degrees, then typically you still can do all these things. You just want to be really mindful about how much you're bending the knee. All right, so the first thing, we're finally going against gravity. We're standing up, guys. So what we're gonna do is, it looks like your standard wall squat, but I'm very specific on the little details and the attention to details that we want for this. So the way I like to start this progression is, let's say the right knee was the one that had the surgery. That foot is gonna be slightly forward compared to the left. The reason for that is whatever foot is further back, it's gonna have more weight through it. So we want to start slowly loading the right leg, okay? So what we're gonna do is, just like on the ground, we're gonna roll our hips underneath us so that our low back goes flat to the wall, and we're just gonna hold here. Your right foot should be further out in front of you than a normal wall squat would be. The reason for this is, as it's further forward, you're gonna have more heel contact on the ground, so we're gonna get, you guessed it, more hamstring. If we're doing this right, you should feel tightness in that hamstring. Now, you will feel quad because we're in a squat, but I really want you focusing on pushing that heel down. As we get better at this, becomes, no pain, and we're getting better range of motion, we're gonna start to bring that foot back so that we're more even and we can start to load this leg. Again, as we continue to progress that, now we're looking at, the 3rd or 4th week, we can actually start putting that left foot more forward to put more weight on this right leg. And we're gonna feel a lot more quad when we do that. Typically, I like to start by holding this for about 30 seconds, and then we're gonna progress from 1 all the way up to usually 3 minutes. And if that gets easy, we're gonna start putting weight in our hands. All right, so as you start to feel that knee loosen up and you're able to bend it more, we're gonna start challenging that range of motion a little bit more. Still, we're not getting too involved with gravity just yet, other than that wall squat I showed. But this is another way to challenge that range of motion even further. Again, if your knee flexion range of motion is limited to 90 degrees because of your surgeon's protocols, then only go to 90 with this. But if you have no restrictions in that regard, then let's take it as far as we can. So you're gonna be laying on your back here, and it's gonna look like a regular old heel slide, but the difference is we're not using a strap. We're not trying to pull our knee. We're trying to actively basically mobilize our own knee with that hamstring. So you're gonna come in here, you're gonna keep your weight heavy on your heel, and then when you get to a limitation, I want you to squeeze your hamstring, and it's gonna feel like it wants to cramp. Then release it a little bit, and come back in, and squeeze. About 2 to 3 second squeeze, and then release it. And back in, and squeeze, and release it. Typically, I like to do 12 to 15 of these for 3 to 4 sets. Another way to challenge this deeper knee flexion range of motion while actually getting the hamstring recruited are single leg bridges. The difference here is when you bridge up, I don't want you to squeeze your glute. I want you to push through your heel and feel your hamstring working. I like to go for about 20 of these, 2 to 5 sets. All right, so it's finally time to start feeling like we're working out more. So what we're gonna do is a heel elevated squat. If you don't have a ramp, I highly recommend you get one. You can get one online through Rogue, through Arsenal, probably on Amazon somewhere. My typical recommendation is a 10-degree incline. 15 degrees is going to be a little bit higher. It's going to be a little bit harder to keep stress off the front of your knee, but you can do it. So what we're going to do is we're going to squat to this box. We're going to fully sit and then stand up. The reason for that is it's going to help us actually absorb weight. We want to be able to absorb weight before we push basically through the ground and start producing more force through that right leg. Okay, so what we're going to do, we're going to be here, we're going to be heavy on our heels like we've been preaching. And when you sit, I want you to fully sit onto your tailbone. Okay, at that point, you're going to stand back up. So you're going to sit, full sit, back up. Now, if you notice, guys, I'm not rounding my back or falling backwards. I'm just slightly unloading my pelvic floor and then standing up. So as we progress that, now we want to start putting force through the ground a little bit faster while still limiting our range of motion with this high box. So we're going to come down. This time I'm just going to tap and stand. Tap and stand. And just like the wall squat, we'll be able to play with our stances based on how we're tolerating and how our range of motion is progressing. So if our one foot is further back, we have more load through that leg. If we put it a little bit more forward, you should feel like you can really tolerate the movement without any issues. So now it's time to squat without the box. So same protocol as usual. We don't want to experience pain. We don't want to experience stiffness, but we're going to come here. We're going to drop down. Those heels are still going to stay heavy, and then we're going to come back up. So we're pushing our knees forward while keeping weight on our heels, and we should be able to go for at least 15 to 20 reps of this. Now I want to really start isolating more weight through this knee, specifically in a bent position, so that we continue to progress the challenge and that this range of motion that we've been improving sticks. So what we're going to do is right foot forward, we're going to go left foot back. All of our weight is on our front heel, but we're not lifting our toes or squeezing our toes. From here, I want you to imagine you're in a phone booth or you're in an elevator and you're going to drop straight down without hitting the front or the back of the wall. Okay, so my shin should be straight up and down, not pushing it excessively forward. I'm going to stay right here and I'm going to hold this for anywhere from 20 seconds to a minute. And I want to typically do about 4 sets of this. If you're feeling pressure in your knee with that, I just recommend you standing up a bit higher. At this point, we're going to be able to start to rep this out. We're usually looking at around a 4-week mark. So we're going to be here and we're dropping straight up and down, keeping the same rules that we talked about, that shin being straight up and down. Once we tolerate this, let's start adding weight to it as long as it's not bothering our knee. Now this heel elevation helps us to offload the front of the knee because it helps us stay heavy on our heel. But as we want to progress through this, now we're at around the 5 to 6 week mark. We want to try to get rid of the heel elevation and start really being able to push through the ground. So now we're in the same position without that ramp. We're able to push the knee a little bit more forward and we're focused on standing up through our front foot. We still want to be heel heavy, but we can start to get more like the ball of the foot engaged. All right, so we're going to cap it off with the dreaded Bulgarian split squat. The reason why this one works the front leg the most is because when the rear foot is elevated, it actually pushes us forward and puts all of our weight on that front leg. Okay, so from here, we're going to drop straight down, keeping that knee in the middle of your foot. And if you feel this in the front of your knee, it tells us 2 things. Either 1, you're not ready for this, or 2, we can simply bring this foot even more forward than it currently is. Okay, that's going to let us shift back onto our heel even more. But as we're progressing this, we want to be able to bend that knee more and more as we load it. All right, guys, so to summarize, in the beginning, we want things to be passive, meaning we're not really recruiting a lot of muscles, and we want to decrease the involvement of gravity. So we're actually going to use gravity to our advantage to start getting some range of motion back. But as the swelling is getting out of our knee, and as we're starting to get some more motion, we actually need the muscles around it to recruit, specifically the lower end of the hamstrings that attach to the back of the knee. Those hamstrings are going to act as mobilizers to give us that knee flexion range of motion back. And so we want to get that recruited as early as possible. So again, we're going to keep gravity out of the picture, and then as we progress to standing up, gravity is going to start to become more of a factor, and then we're going to introduce weight and more challenging movements to further challenge that knee and to further get more and more range of motion. So what we expect is that you go through this progression with the approximated timestamps, and at the end of this progression, you're gonna feel how much looser and less restricted your knee is. If you found this information helpful and valuable, please like, comment, and then share to anyone that you know, any teammates who also had an ACL injury, new or old. This way we know we can get them back to getting that range of motion.